Good afternoon, everyone. So, myself, Dr. Krishna Teja, I'm consultant via surgery at Shankar Foundation Eye Hospital. So, today I'm going to present a case of 33-year-old female who presented with painless blurring of vision in both eyes since 1 month. Her best corrected visual acuity is 612 in both eyes. Anterior segment examination was normal, whereas posterior segment examination showed hyperemic disc edema with flame-shaped hemorrhages in both the eyes, with macular edema, especially in the nasal macula, and small round hypopigmented subretinal lesions were seen at and around the fovea in both the eyes, and OCT showed neurosensory detachment along with the hyperreflective foci between NSD and RPE in both the eyes. So this is the OCT of the respect. And I made a provisional diagnosis of query neuroretinitis and advised the relevant investigations and started on tab Bactrim DS BD for 1 week and stopped later. And 4 days later, she presented with the investigation reports. So hemoglobin was 7.1 grams and smear showed moderate anisocytosis along with hypochromasia, and MRI showed empty cella, and visual field showed bitemporal hemianopic field effects in both eyes. And rest of the investigations turned out to be normal. And provisional diagnosis of established papilledema due to query IIH was made along with anemia and empty cella, and referred to neurologist, so who measured the CSF opening pressure, and it was found out to be very high, that is 370 millimeters of mercury, and analysis was normal. And few small vessel ischemic changes were seen in the fresh MRI, and started on oral glycerol 20 ml TDS. So in spite of repeated insist on anemic correction, she didn't get it done. Now we re-insisted again. So later on she went to physician, and 2 whole units of blood transfusion was done. Now hemoglobin improved from 7 to 10 grams, and within a month again it dropped back to 7, and again the same cycle was repeated. So then physician felt suspicious, and he advised bone marrow aspirate examination, where pancytopenia was found out, and immunohistopathology showed plasmacytoblasts, and then FTG PET scan was done, so, and it turned out to be active multiple myeloma. And she was started on chemotherapy, and she completed 8 cycles by June 2023, that is within a span of 6 months. And this picture clearly shows this was the picture before starting chemotherapy, and this is after. So very well resolving disc edema along with macular edema is seen in the both eyes. And in the OCT also, NSD got completely resolved, and hyperreflective foci also got resolved in both eyes. And comprehensive quantitative serum panel showed monoclonal gammopathy with heavy chain of IgG and light chain of kappa. And on her final visit, ocular condition was stable and she was in remission. So this was the thing, and few other case reports which were published in 2011. So case 1 showed a Greek woman, 82-year-old. Her vision is hand movements in right eye with high IOP and history of stage 3 myeloma. She showed a superior temporal quadrant plasmacytoma in the right eye, and here we are able to see the involvement of iris and ciliary body, and iris neovascularization is also seen, and ultrasonography showed infiltration of the plasmacytomas. And gonioscopy, complete obscuration was seen by the tumor, and biopsy and histopath analysis confirmed the multiple myeloma, and she was started on external beam radiotherapy, but she died due to systemic complications after a month. And another case report, here we are able to see one pedunculated mass in the left eye superior temporal quadrant, and there is no intraocular extension in this case, I mean intraocularly, and so chemo was started for the case after confirming with the biopsy and histopath analysis. But again after 3 months she presented with diplopia vision. So then on evaluation we are able to see the retrobulbar tumor in this case, but there is no intraocular extension, and CT showed intraconal plasmacytomas. One is between superior and medial rectus, another one is between medial and inferior rectus in this case. So she was given both the combination treatment, and it got subsided, but she died after 5 months. And one more case is the man of 76-year-old Italian man, and who presented with painful decrease of vision in both eyes. And the same thing, but here in this case, the greater wing of sphenoid also got involved in this case, and he was started on the combination of external beam radiotherapy along with chemotherapy. And after 2 months of treatment, patient recovered well. So take home message, don't neglect the subtle clinical findings like anemia in this case, and each and every case needs thorough ocular along with systemic evaluation, which may help in diagnosing life-threatening conditions in our ophthalmology OPD itself. And rare conditions are seen rarely, but you might be the person. Thank you.
Thank you. Excellent case. When I was just thinking retrospectively, probably whenever there is a pancytopenia anemia, maybe a bone marrow biopsy would have given it away right from the beginning,
actually, right? I couldn't get all the exact reports, man. So, but oncology, when I had a word with him, they said they have already performed it. But
before also, but they couldn't.
They
couldn't get plasmacytoma as a diagnosis at that point of time.
When we referred back, ma'am, especially after the physician evaluation. So when they got referred, along with the FTG PET scan, that was also done.
Okay. Okay.
But I couldn't get the report, so that's why I didn't document.
No, what I meant initially, they did only peripheral smear.
Yes, ma'am. That was done by the physician.
Correct.
But when the patient was referred to the oncologist, they have performed
They have done it.
But I couldn't get those reports, so that's why I couldn't add it.
Right, right. Can you show the fundus picture? Just a question to the students here. It's a differential diagnosis. Oh, can we have the presentation on for a minute? Difficult? Yeah. What are the other differential diagnoses that you would think of? It's a nice picture. This optic disc. Differential diagnosis. This is a very, very rare case, and it's an amazing case. But if something comes like this, what else would you think?
They can describe first of all.
Yeah, right.
What are the findings you are seeing?
Shubha, do you want to take this up? Because you're a fellow. Most of them are postgraduates. Yeah, I mean something that, which very strikes, we always think of leukemia and other rare things. Optic disc nerve drusense, sometimes really presents like this irregular elevated optic disc. So it's always good to do an ultrasound B scan. Okay, that just gives away the diagnosis. So never forget, one of the differential diagnoses, when you get a very crowded elevated disc bilaterally, almost symmetrical, think of optic nerve head drusen. Ultrasound B scan gives you the diagnosis. But well, this is a very rare, interesting case, just for a discussion. Thank you so much. Thanks a lot. Yeah.